Dr. Masihiro Muete, who incidentally is from Botswana, has become the first woman to be appointed Regional Director for Africa. And according to her profile, she aims to build a responsive, effective, and result-driven regional secretariat that can advance efforts towards universal health coverage and accelerate progress towards global development goals while tackling emerging threats. She was in Abuja recently and had a chat with my colleague, Maokwe Ogun.
You are the first female regional director of the WHO for Africa. Would you say that you've noticed any peculiar challenges? I mean, do you notice some challenges than your male counterparts would have?
Well, first of all, I'm very honored to have had the opportunity to be the first woman regional director of WHO in the African region. And have I noticed any particular challenges? I would say some. I think it's in common with the women's experience in positions of leadership.
What have you noticed?
Well, you need to convince people. You need to convince people not only with the content of your ideas, but also, in a sense, with your authority. That, I mean this, and this is what's going to happen, and this is what we're going to do. I think it's very much part of the social setting in which we're all working, and I think it's not unique to this position. Mm-hmm. Many women have a similar experience.
And now you have new goals. I mean, the WHO has new goals. The MDGs didn't quite work out, but, it hasn't stopped them from creating new ones, which is the SDGs. How well on our way would you say we're going to be for the target of 2030 for the SDGs?
It is ambitious, but I personally believe in ambitious targets. This is what drives us to do better. And I also think that we learned a lot from the MDGs. For example, we paid less attention to issues of equity in the MDGs. So we are driving strong vertical programs, HIV/AIDS, child survival, and with the SDGs, we'll take more account of the most vulnerable people, those who are most disadvantaged. The issue of universal health coverage emphasizes that every single person, no matter what their socioeconomic status, whether they live in a town or in a faraway village, has a right to health care. And we are developing specific strategies to ensure that this happens, because it doesn't trickle down naturally. It needs to be addressed specifically to make sure that when low-income people go to a clinic, they don't have to pay directly. We put in place insurance schemes, for example, where those who have more money fund those who have less money in a pooled kind of mechanism. So those issues, those aspects, are going to help us be able to make progress towards these.
You're going to be relying on a lot of governments to be able to do that. How well are the governments of the different countries which you have to work with cooperating with you?
The governments have signed on to the agenda, so to speak. They went to New York, and I think it was more than just heads of state going to a meeting in New York. They have internalized this. Many of them are already starting to develop their plans to adjust them to this new vision. For them, it means several things. First, additional domestic funding. So here, I think we have more work to do to convince ministers of finance and parliaments that health is a good investment. And they're starting to pick up on this, that, if you're going to make economic progress, you need educated people, you need healthy people, you need innovative, creative people, and health is a good investment for that.
Looking at the fact that only recently the World Health Organization says that Africa accounts for many of the world's reported disease outbreaks, what would you say, has been the response of the WHO? First and foremost, what makes Africa particularly prone to disease outbreaks?
I think partly it's our ecology, where many of our countries are hot, because many of these diseases are driven by vectors. So malaria, yellow fever, chikungunya, even Zika. These are diseases that are transmitted by vectors, which tend to propagate where it is hot and sometimes where it is humid, etc. So part of this is environmental. Disease transmission is inevitable in certain contexts. What drives this to become an epidemic is also a feature of the the health system in a country. I believe that the Ebola outbreak in West Africa was a very seminal moment in alerting not only WHO, but the international health and development community of the need to invest in these systems, including investing in WHO itself to make us more capable of playing our role. And we have a new reformed WHO program for emergencies and outbreaks, where I have started to see already, it's been going, the process of this reform for a year and a half, that with additional resources, we are able to support countries, first of all, to assess how ready they are to deal with an outbreak. So we lead a process of what is called joint external evaluations with other partners who work on health. We arrive in a country and look to see, so how is your system set up to respond, to detect early an outbreak? We carry out an objective assessment and we identify the gaps, and then these countries develop plans and look for money to improve their systems. That's one. And when there is an outbreak, we are able now, with additional capacity in WHO, to very much more quickly be on the ground and help the country to organize a response in a certain way. So we've defined a new way of working on outbreaks.
It's only recently, I mean, you did mention that Ebola was a seminal moment. There was huge criticism for the World Health Organization's response to the Ebola crisis, and as a result, those proposals were mentioned by they came up with with the reforms themselves. And from what you say, it seems that they're already beginning to work out, as it were. But, you know, there was also word about how the WHO itself is structured. Would you say that that structure itself also helps the implementation of some of these policies and reforms that you've come up with?
Oh yes, I think so. Much of the concern about how WHO is structured was the fact that we are a three-layer organization. So we have a country office, we have a regional office, and then we have our headquarters in Geneva. And part of the concern was that then you have many layers of decision making. The particular concern was that the regional level would be a delaying level of decisions to take action on the ground. So part of the reform that has been carried out has been to have a very much more joined up program. And as the regional director, for example, I supervise my director of outbreaks and emergencies, but I don't, so to speak, get in the way of decision making between him and his headquarters counterpart and the country office representative. I keep myself informed, I advise them, I demand to see the progress that we're making, but I'm not in the day-to-day, do you agree to this or not, which I think facilitates the faster action. However, I'm able to mobilize the rest of the regional capacity of WHO to support the response of these teams.
And now only recently, monkeypox has been reported in Bayelsa State. We've heard it spread to a number of states, even though the Nigerian government says that, well, we're not very sure it is monkeypox just yet because they're not presenting typical symptoms. Is it something that the WHO is also monitoring?
Yes, we're very much working with the Ministry of Health in monitoring this. We are waiting for confirmation of the monkeypox from the Dakar. We have a reference center at the Institut Pasteur in Dakar that is going to provide the response to this. We're also, I believe, we're waiting for another confirmation from the CDC in Atlanta.
Well, we do wish you all the best as you go about, you know, your duties, and hope that you do have a very successful tenure as the WHO Regional Director for Africa. Dr. Matshidiso Moeti.
Thank you.
For coming
Thank you very much.
Thank you.
Thanks.